Every 2 minutes, a woman around the world dies of cervical cancer. According to the World Health Organization, 14,089 women are currently suffering from cervical cancer here in Nigeria. Cervical cancer is the cancer that affects the lowest part of the uterus in a woman's body. It is caused by the human papilloma virus, HPV. HPV is a sexually transmitted infection. It can be gotten through the anus, vagina, penis, scrotum. Over 70% of cervical cancers are caused by HPV-16 and HPV-18. The risk factors associated with contracting HPV are 1. Smoking, weak immune system, multiple sexual partner, early exposure to sexual intercourse, and usage of synthetic estrogen. The risk age group for contracting HPV is 25 to 49 years. Even though at the age of 15 to 17, a woman can contract it. This is unfortunate. Stay tuned and follow me.
My name is Dr. Badiya. Cancer of the cervix is cancer of the lowermost part of the womb, which is also called the neck of the womb. It's a condition where there is excessive and abnormal growth of cells which grow abnormally and in disarray and then can spread to other parts of the body. It is the commonest form of cancer in females in developing countries and the second most common cancer globally. 80% of the incidence is found in developing countries, and 80% in developing countries present with advanced disease. This is because of lack of awareness in poverty, and then the risk factors which are associated with cervical cancer. Cervical cancer has many risk factors, of which human papilloma virus has been found to be significantly associated with invasive disease and the pre-malignant conditions. It is associated with about 99.7% of all cases of cancer, and these risk factors, apart from human papilloma virus, include the presence of multiple sexual partners, smoking, multiparity, early coital activity, early sexual debut, and then we have some high-risk partners which can transmit the virus, such as those who have partners with penile or anal cancers. And then we have, with the advent of HIV/AIDS, we have seen an increase in cervical cancer. Cervical cancer, most of the time, may be asymptomatic and cannot be detected unless when screening is done. Screening is very cost-effective and has caused a significant reduction in the incidence of cervical cancer in developed countries. That's why we have this inequality and disparity between the incidence of cervical cancer in developing countries and in developed countries. They have a cost-effective, proper recall system, not like in developing countries, Nigeria inclusive, where we have opportunistic screening, or we just have a screening program which occurs just once in a while. Screening is, pap smear screener has been found to be a very cost-effective way of diagnosing cervical cancer and other pre-malignant conditions. And the most important thing is that it can be detected at least 15 to 20 years before you detect the disease. So if you see somebody with a pre-malignant condition, you can treat it before it develops in 20 years' time. And screening has to be frequent. It has a timing, because those who have been found to have cervical cancer have been shown to either have not been screened, or they have been taking their pap smears sporadically, or they have not been screened in the last 5 years. But if you have proper screening control program, then it means all the cases will be detected before they even become invasive cancer, or even if it's cancer, it will be detected at an early stage when it's curable. So patients may present may be asymptomatic, like I said, or they may present with postcoital bleeding or offensive vaginal discharge. It may seem abnormal to the woman at that point in time. And then intermenstrual bleeding, irregular bleeding that does not occur with the regular menstrual cycle. Then apart from that, you can have other symptoms like cough, weight loss, urinary symptoms. It can affect the kidneys when it gets to an advanced stage. But in the early stages, it may just be that of postcoital bleeding or vaginal discharge, or even be asymptomatic. Other forms of screening include the visual inspection with Lugol's iodine or visual inspection with acetic acid. WHO, the World Health Organization, has advocated these types of screening for low-resource countries like Nigeria, where perhaps screening may not be, the coverage may not be as much as developing countries. And then we have also the digital with advanced technology. You can even take still images or real life images, and then you can transfer it to the experts even when they are not present. Screening should begin ideally at the age of 21 years, before the onset of sexual activity. And then from there on, you continue 5 yearly until you reach the age of 64. Then after that, unless there is an abnormal smear, there's no need to continue screening. So that means if a woman has a 3 consecutive normal pap smears, or she has had 10 years of normal smears, then she does not have to continue after the age of 65. But for those who are immunocompromised, because HIV-2 and AIDS has caused an increase in the incidence, they have to be screened annually because of the higher risk in these women. So treatment can be curable at the early stage, and it includes surgery, radiotherapy, and chemotherapy, usually combined chemotherapy and radiotherapy. So if patients present early, the cancers that are caught at an early stage can be curable. And HPV, which is a sexually transmitted disease, is asymptomatic. So unless you go for screening, you may not really detect the virus in any woman. And it's a very common virus, which is associated with other cancers too, apart from cancer of the cervix. There are over 200 types, but the most commonest types are the associated with cancer of the cervix are 16, 18. Some other types, 33, 65, but 16 and 18 are the commonest types associated with CA cervix. And then now some vaccines have been introduced, although not very common in developing countries, but like in developed world, from the age of 9 to 11 years up to 12 years, they give their girls HPV vaccine. There's the Gardasil, which covers for 4 HPV types, and then Cervarix, which just covers only 16 and 18. So there's the catch-up population that can also benefit from the vaccines, like those who are up to the age of 25, who can also benefit from vaccination against this virus. So introduction of this vaccine has significantly also reduced the incidence of cancer of the cervix, and we hope it will be incorporated into our routine immunization, so that we in developing countries can benefit where we have a higher incidence of cervical cancer. And this reduction in incidence in cervical cancer in developed countries has been really associated with the effective screening program that they have, regularly recalling all the patients who have been screened when they are due for their next screening, pre-malignant lesions, even before they become cancer invasive.
Hope to see you some other time. What is cervical cancer?
Cervical cancer is a type of cancer that affects the lower part of the uterus, that is the womb.
What preventive measures can one adopt to prevent cervical cancer?
Avoidance of multiple sex partners, avoidance of early sex, and then avoidance of using drugs.
Have you had your pap smear?
No, I haven't.
Why haven't you, ma?
Just like that, I haven't yet.
You need to do it.
All right, thank you, I will.
Thank you for your time. What is cervical cancer?
Cervical cancer is the abnormal changes in the cervical tissue through the entrance of the wall of the uterus of a female, which most especially it leads to abnormal bleeding in a female.
What preventive measures can a woman adopt to prevent cervical cancer?
Well, to me, one, she should avoid using contraceptive pills for a long time. And two, multiple sex partners should be avoided as well. And also, she should avoid smoking as well. And she should also avoid early early birth. That's giving birth at earlier age. Thank you.
Have you had your pap smear?
Yes,
When?
that was 7 years ago.
Don't you think you should have it again?
Yes, I think I should go for it again. I'll try as much as possible to go for it.
Thank you for your time.
Thank you very much. I'm grateful.
It is very imperative for sexually active women to undergo a pap smear test every 3 years in their lifetime. This will enable the cytologists to be able to detect any cellular changes in the cervix and to be able to prevent any development of cervical cancer and to also avoid infertility irrespective of your sexual status. I advise and we advise that you do your pap smear to save lives. You can like and follow us on our Facebook page, Health District Africana, YouTube, and Instagram, or on our website, www.healthafric.com. Thank you for your time. I remain David Iyela.